I do not think we can say at this point in time that we do not have the support we've asked for. So now I think what we have to do is demonstrate that it should be sustained. And demonstrating it's sustained is clearly going to demonstrate not on repeating that there's a problem. I think people have got that. It's actually providing solutions in a reasonably systematic way, backed up by clear evidence that things are working, and a clear ability, when things are not working, to say, let's stop. If we cannot do that, ministers will find it impossible to maintain the support that currently is. So my first point is a very obvious point, really, but it is now is our time to demonstrate what works and what doesn't, and then to concentrate on those things that do. The second thing I wanted to say is that it is really important when we're talking to those who are involved in decisions in policy, both in affected countries and in donor countries, that we make three fundamental points as well as making our particular pitches. The first is, this is a very complex problem. Pretending it is simple is extraordinarily unhelpful. It's a recipe for broken promises later on the line. Secondly, that for many of the solutions that we need to look for, the outcomes are going to be slow, and we have to be aware of that. And the third point we have to make is that in much of what we need to know, the evidence base is actually extremely weak. We think things work, but we simply don't have really good evidence of it. And we have to be upfront about that, because if we are not, then 2 or 3 years down the line, ministers, the taxpayers, and in countries, more importantly, where things are happening, are going to say, you promised us you can make a change, you haven't, why have you not done so? It is really important to be straightforward about this.
There's been a lot of discussion about how industry can engage beyond technology, beyond products, and we commit to, as part of what we're doing with Healthy Imagination, is to look at outcomes and use our resources to be able to understand outcomes, evidence generation. So the commitment that we have is to think about things in the eyes of the patient, in the health systems, and to be a partner from the private side to talk about outcomes and not just the technology.
We have a tremendous opportunity to save lives and really make a difference in the lives of moms and babies worldwide. What it takes, from our perspective, is to continue to invest in innovation and technology, but recognize that while there's a lot of complexity, the solutions need to be very simple. And to have simple solutions, we need to understand the local insights, and we need to work with partners, many of whom we work with today that are in this room, to really make a difference and deliver those simple solutions in a way that will ultimately enable us to achieve our goals, and then monitor it as we go and continue to learn.
I want to submit that what I take away from here is that providing solutions to some of our problems actually are the soft issues. Your ability to engage with us in order for us to be able to do business in a totally different way. How do we plan differently? How do we implement differently? What metric systems do we have to introduce to ensure that we can measure and effectively evaluate what we are doing? And I think that industry has all of that. And I think that industry can provide those solutions to us in order for us to do what we do differently from the way we do it. Because I think in doing that, we actually can utilize the little resource which you have, in a more efficient way and actually deliver better to our people.
I would say engage more deeply. Engage more sincerely. I don't think there is place for smart people in this world anymore. There's place for real people in this world, and I think that's what this whole discussion is about. The second thought that came to my mind about, when I engage with the political system, maternal child health is the soft part of a politician. They think it's about, babies and moms and we should be nice. But what I see, the biggest fear in the minds of political leaders today is about future. I know it is true of Asia, it's true of Africa. Political leaders are deeply concerned about future. And I don't think we have communicated to the political leadership the cost of neglecting women and babies across generations. It's strange that this fantastic knowledge and research has not been communicated. We address today because in a democracy, you have to be realistic. Technology has a role, no question about it. Technology might also teach us how to deliver better. So everything has a role, but the fundamentals have got to be right. There's a hardware-software balance. We started the National Rural Health Mission. It was a reaction to vertical programs in the past. So everybody said, we need to build health system. Now we are building a health system. To discuss anything on software means, Dr. Bhan, you are again bringing vertical programs in. We're always between these extremes, and I think these are all reactions to the previous decade. What we really need to do is to be more integrated in our thinking and built on the past. So I'm all for technology, but I think these maternal newborn programs have much more than technology in them. And so if technology can help us deliver better, it's extremely powerful.
In many ways, it's a difficult meeting to sum up because we've covered a lot. But actually, Julio Frank's acronym, I think, is incredibly useful. LIST. Leadership. Well, there's no shortage of leaders in this room. And I think the challenge for us is to lead. And the point has been made very strongly several times in this session about accountability. And one of the major responsibilities of leadership is accountability. And we ought to be open to challenge. And that's what boards are all about. And that's what electorates are all about, actually. So the challenge has got to be there as well. The I is for institutions, but I think in this building it's also about infrastructure. And we do need both. And without infrastructure, I think that the solutions will be hard to find. And infrastructure is one of the biggest challenges that faces all nations, actually. This building may take 1,000 years to fall down, because the civil engineers built it at the peak of their powers. But you've only got to walk around London to see that the UK infrastructure is in many places crumbling. So it's something we all need to focus on. Systems, no question about that. We've heard about opportunity cost, and of course one of the things is not to be too siloed. Of course we need vertical systems, but the diagonal is probably a good way of looking at it. Because actually, if you have a good health system in place, you will be able to deal with maternal and child health, but you will also be able to deal with malaria, pneumonia, and all the other ailments that we're going to be prone to for a very long time. So it is about systems. And the T, of course, is technology. And we've heard about the power of technology. And there's no question that we can solve problems faster now because we know the fundamentals of health and actually the power of technology, and particularly the sort of technology that's fit for purpose. So machines that are designed locally for local purpose are going to be much more effective than the very expensive scanners that adorn the expensive hospitals in the north. So, and then finally, lists themselves. And Atul Gawande has been writing very lucidly about this recently, but this goes back a long way. We have to be accountable for doing things properly. And actually, the medical profession has not been very good at using checklists. But we know that checklists make a difference, and that we know that we do forget things if we do it all from our head. So using lists themselves is really important. We've heard that talk is cheap, and we've had plenty of talk here. The challenge now is to turn that into action. Another point that was made very strongly today, and rightly so I think, is we probably didn't hear enough of the voice of the customer. And in the case of pregnancy and childbirth, there's been a tendency to medicalize it, and of course medical things go wrong. But actually, at the end of the day, this is a part of normal human physiology. And actually, this is something that's important for our future. There's 4 other things that I've picked up. One, I think, it's generic to all our meetings. It is the power of data. And one thing that sort of persuades politicians is data, particularly if they can't refute it. They may want to brush things under the carpet because it's inconvenient, there are inconvenient truths, but rigorous data are the way to deal with that, actually. So we've all got to be responsible for collecting data, for facilitating the collection of data, and for data transparency. So from a news conference to talk about the 10th anniversary of the human genome, the key feature of the human genome, apart from its technological achievement, was that it was all put out there for anyone to use for any purpose, anywhere in the world. We have to share data. The second point I've taken away is catalysis through partnership. And I think the point was made very well by Andrew Whitty and others industrialists here, that it's about leveraging the core capabilities of companies. It's not simply asking companies to shell out lots of money to do things. It's actually about leveraging the power of Johnson & Johnson, of GE, in knowing what they do well, the skills of their staff, the skills of Nokia. Lots of opportunities there, and it's about entering into the right discourse with industry. It really isn't about beating them up and telling them they're doing it all wrong. It's actually about engaging with them, talking with them, partnering with them. There's a tendency to bash industry in some quarters. It doesn't make sense. Who makes products? Industry. Who makes drugs? Industry. And so we've got to work with industry, and we've got to leverage their core capabilities. But it takes us to a third thing, which is related to that, which is about values. And I think we've seen very clearly value systems espoused from everyone in this room, which are about the right values, which are actually focusing on the needs, focusing on what really matters. And so having strong values is incredibly important. And I think where relations fall apart is sometimes where values fall apart. And so our value systems, in whatever we do, are incredibly important. And then the two Whitties, I think, told us the same thing but in different ways. So Chris Whitty talked about complexity and the fact that you actually can't look at everything in the same way. But Andrew Whitty dealt with that by saying pragmatism. And that is, I think, always a key issue. When faced with complexity, do something. And that was what I think Andrew said very well, but understanding the context of understanding complexity. And then I think we've heard two other things today which are very important. One, we've heard the importance of agility. And frankly, I think that we could all be more agile. Business which has a bottom line to deal with has much pressure to be, more pressure to be agile than some of the rest of us. But actually, we do need to get things done. And I think the other point that came through very strongly is local solutions. And this is a global meeting, but I think Zulfi very clearly made the point that actually this isn't the whole solution, it's only a tiny fraction of the solution. Meetings like this have to be translated locally, and that's something that you have to organize yourselves.